The reason why hospital avoidance programs are so important is the benefit it gives not only for the patients but for the hospital. The patient has that sense that they're going home and they feel safe and secure. If avoidance programs aren't in place, many rehospitalisations will occur. It could be for a range of different reasons. Somebody's not eating nutritionally balanced foods, medications are missed, and these are the number one reasons people are quickly readmitted to hospital after discharge if services aren't set up correctly.
Well, my husband has had a lot of health problems, which have become worse as the time's gone by, and I'm not in the best of health. I get very tired. I have cancer, but I'm in remission, which is good. But I just find it very hard and stressful looking after Rob because I worry. He has had recently a couple of falls which put him in Mount Wilga, and the social worker there told us about Just Better Care, that they had a hospital to home plan that we could take advantage of, which we have.
We went in to meet with Jocelyn and Robert in their home to complete the assessment and to get a picture of what services they require, what their needs are, and what links we can make in the community.
The first thing that we had somebody come on the morning after Rob arrived home from hospital to help him with showering, and she was able to tell him the best place to put the chair and his walker and where to have his towel, etc., which was very helpful. Another great thing I've taken advantage of is ironing. I have arthritis in my neck, and standing at an ironing board is not at all comfortable for me. So that's wonderful, but I also know I can get a driver to take Rob to appointments, and myself if needs be, which would be a great help. And I really must take advantage of getting them to take me shopping.
The hospital avoidance service has helped Jocelyn and Robert to remain at home and to feel supported in their home environment. They can be proud of their home because we're assisting with domestic services and with transport services, so they can continue to feel like a member of the community.
When I was patient in hospital, after the surgery, the discharge planner came and to see how you're going to cope at home, and she could see I wasn't going to by myself, and so she contacted Kincare, and it went from there.
The goal of all Kincare services isn't to go into someone's home and take over, it's to support and help maintain independence. Our team worked very closely with Emma, the customer care manager, ensuring someone was going in each day to help with showers and identifying small little wins where Catherine was more independent for herself.
I've got to say I was getting pretty depressed, just being confined to home when I've been a very independent person, capable of looking after myself and other people normally, and now the shoe was on the other foot. I don't know what I would have done without it to start with. I had some help, personal care, 1 hour a day. I just had a hip replacement, but I was in a cam boot for other problems. Because of the hip, I couldn't bend down to put the boot on and off, so totally reliant for someone to come each morning to help me get around. They've just been amazing. And also because it's my right foot that's affected, I can't drive, so I've had help getting to medical appointments, which has been a huge help.
She was feeling, as she's mentioned, quite depressed when she was in hospital, and fear also of how was she going to manage at home without any extra supports. So now her confidence is starting to build up, and she is improving in her mobility and able to be more independent for herself.
It's great. I can ring Emma. She always answers. Nothing seems to be too tricky. You know, I ring almost embarrassed to ask for some help, but no problem, and I think I've got better quicker. Well, I have obviously got a lot better with that help. Still ongoing, but getting there. That a few months ago, I didn't know how I was going to cope.